I've been thinking about my IFAK lately, mostly because I'm about to get on a plane and spend the better part of a month traveling around Japan. And while I was packing, I caught myself doing something I complain about other people doing all the time. I was taking a medical kit designed around one environment, one set of risks, and one set of assumptions, and just assuming that I should take the exact same thing somewhere completely different, which raised a pretty obvious question. What should an IFAK actually look like when you're traveling? Because I don't think the answer is just the same IFAK, but now as a passport. And apparently the CDC doesn't think so either. Their current travel medicine guidelines says that the contents of a travel health kit should change based on where you're going, what you're doing there, and how long you're staying. What medical care is available, how many people you may be responsible for, your level of training, and even how much room you physically have to carry the thing. This sounds obvious when somebody says it out loud, but it also describes almost the exact opposite of how we tend to talk about IFAKs. We usually talk about them like there's a correct list: tourniquet, gauze, pressure dressing, gloves, maybe some chest seals. Put those things into the correct tactical pouch, and congratulations, you have completed medicine. But that's not really how medicine works. It's built around a mission, and traveling changes the mission. I still want trauma capability. I'm not suggesting that because I'm going overseas, that catastrophic bleeding suddenly stops being catastrophic. I'm still going to have a compact trauma component containing the hemorrhage control equipment that I'm trained and comfortable using. The difference is that I'm not building the rest of the kit around the assumption that traumatic injury is the only medical problem worth preparing for. Because consider what I'm actually going to be doing: airports, trains, hotels, walking around cities for hours, eating food that I'm not accustomed to, probably destroying my feet because apparently every trip to Japan has to double as an unsolicited endurance event. Those are very different circumstances from the ones that shaped the traditional belt-mounted IFAK. I actually learned this lesson the stupid way the last time I was in Japan. I managed to seriously injure my knee on an e-bike that you can rent at any combini, and discovered that the medical kit I'd brought with me was exceptionally well prepared for me to treat a massive hemorrhage, and almost completely useless for the injury that I actually had, which was a fun way to discover that my knee had neglected to consult the packing list. If my international travel medical kit contains 3 tourniquets and a decompression needle, but absolutely nothing for a blister, I may technically be prepared for trauma, but I'm apparently planning a considerably more exciting vacation than the itinerary suggests. So what am I actually going to put in my travel IFAK? I think we should start with the pouch itself. I have 2 options here. One is the TT IFAK that I've showed before on this channel. The other one here is some cheap Amazon fold-up that also goes inside this little sleeve that you can pull out. I'm not sure that I'm sold on this one. It seems like it's bigger than it really is. But also the TT IFAK ends up being kind of limiting as well. Inside this little guy here, we can include all of the boring stuff. We have our non-adherent wound pads, which I think are important to bring. We have some sterile gauze swabs. We can include some Band-Aids. I'm going to include a few of them, but they're also something that you can get overseas. That's not something that is a particular challenge to grab. I am also going to bring these gigantic, they're basically gigantic Band-Aids. They're not going to fit inside this little guy, so they're going to go inside the TT IFAK. I am also bringing some moleskin. When you buy moleskin, you don't actually need to grab pre-cut ones. You can just get them and cut them yourself. We're already filling this guy up. I can see that this is going to be a little bit more of a problem than I had previously expected. We can put our cleansing wipes. We can put our iodine wipes. We can put some sting relief, which is also important to have. Burn care gel. We can do some bug repellent wipes. I like these quite a bit. I don't know if I'm going to be able to find bug repellent wipes overseas. However, I do know I'm going to be able to get bug spray. We can include some more antiseptic towelettes, some sting relief wipes that are already in there, some ibuprofen, just a few small ones. You're going to be able to buy more at any not convenient. You're going to be able to get them at the pharmacy. And then some more little Band-Aids. That fills this guy up pretty quickly. I'm also going to include tweezers in here, and since there seems to be just a little bit more room, I want to pack it completely. Let's do that. I'm going to throw another pair of tweezers in there as well, because they're going to serve a different purpose. One other interesting piece that I want to put in this kit is this metal card. It's for scraping up stingers and things like that, just in case you get stung. Now that's the boring kit. This guy, I'm not going to use this guy. So let's talk about our actual IFAK, the fun stuff, if you will. One thing that I'm not going to include in this kit is Quick Clot. I'm probably going to get flamed for that, but you know what? Quick Clot ends up being more of a nice to have than a have to have, especially on a foreign travel trip, and especially in a place like Tokyo. So, what am I going to include in our nice little IFAK? First things first is going to be the TCCC card. This is always going to be nice to have, and it takes up almost no space, and it will help identify treatment that you have done on a patient or yourself. So let's take these big ol' bandages, and I'm going to actually put them behind the TCCC card. Other things that I want to have in my foreign travel kit: chest seals. I actually went back and forth with myself about the inclusion of chest seals, and I ended up deciding that yeah, we should have these. Tourniquet. Which tourniquet am I going to include? I feel like I'm going to go with the soft T. And that's simply because it is more compact, so it's going to take up less space on this IFAK. Gloves. Gloves are an absolute must-have. I am going to include a survival rescue blanket. Normally, I don't include these in my kits. I think they're kind of worthless in most situations. However, when you're traveling and you're out far in the woods, these could end up actually saving a life. Compressed gauze. Compressed gauze is an absolute must-have in every IFAK. I am not going to include an emergency bandage or an Israeli bandage. They just take up space, and I want this kit to be as compact as possible. I am going to include this mini compression bandage, however, simply because that's more stop the bleed. Self-adherent gauze, tape, and medical tape. That's always a necessity. Trauma shears. I do want trauma shears in my kit. They're going to go in here for now simply for demonstration purposes. However, when I travel, I'm actually going to put them in my checked luggage. I'm just going to have to remember to put them back in my kit. And a compression bandage, like an ACE bandage. All right. Blanket, you're going in the boring kit, and Z-fold gauze, you're going in the cool guy kit. Okay, there we go. Now, why did I decide to go with the TT IFAK? That's simply because I can take this off, leave it at home, and then I have this huge panel here to go inside my everyday carry bag, which has a big panel. It's a big Velcro panel. I'm going to take my firearm out of it, and I'm going to stick this cool guy on it. And that's my travel kit. I am leaving the SAM splint behind, it makes me sad. I love my SAM splints, but I'm leaving it behind simply because there's just not enough space. If you enjoyed this video, I really appreciate you sticking around till the end. Thank you so much. I would also appreciate it if you would like, comment, subscribe, and maybe share this to a friend of yours that is traveling soon. What are your experiences with traveling and medical overseas? What kind of IFAKs have you carried? Please let me know in the comments below.